So today I will be doing a case report about tumors, and regarding the identification of the patient, the name of the patient is Marcela. Her date of birth is 26th of October of 1997. Her address is Karl Marx 31A and her occupation is a student. Regarding her subjective examination, her main complaints are pains in the right side of the chest, dyspnea during inspiration and at rest, paroxysmal cough, very strong cough with secretion of little amount of sputum and sometimes with little blood strikes. And she presents subfebrile temperature, general malaise, and tiredness. The patient has as associated complaints difficulty in sleeping, difficulty during any exercise, absence of appetite, and weight loss. Regarding the history of the patient reported being sick for the last 6 months with general malaise, and she did not went to the doctor because she thought that she had a common flu or she was not feeling that much sick. And she did not like hospital. So the patient does not feel the need to go to the doctor and report her symptoms. And the patient also reported for the last 6 months weight loss. She lost 5 kilograms. And during the last 2 weeks, all the symptoms got intensely and normally, periodically, increased. So during the last 2 weeks, she started having dyspnea at rest, periodically sputum containing blood strikes, increase of general malaise, increase of tiredness and febrile state. Every evening, she presented a 37.2 around temperature every night, and she started feeling strong pains in the chest, especially when walking or doing any type of physical effort. Regarding the patient history, the patient did not present any chronic diseases such as hepatitis, HIV, or diabetes. The patient have never gone through any surgical procedure. The patient smokes occasionally when she is stressed, but not a lot. The patient occasionally consumes alcohol regarding parties, for example, and the patient presents a bad diet and she's sedentary. And regarding what the patient said in her defense is because she's a student. The patient did not report the consumption of any continuous medication besides occasional non-steroidal anti-inflammatory drugs for headache, for example, of muscle pain. Regarding the family history of the patient, the patient, as there's the presence of diabetes and hypertension in her family. A lot of family members has hypertension and a few of them have diabetes. And the patient said that she was tested for all those diseases long before and she tested negative. But the next step is to retake those tests to make sure that the patient does not present any symptoms of any chronic diseases. Past history of the disease is that the patient has never presented any major health problems besides occasional headaches, muscle aches, or things of that sort. And regarding the conclusion of subjective examination is that according to subjective examination, the patient might have a tumor or right heart failure, and that might be pulmonary embolism, chronic obstructive pulmonary disease, which is for short COPD, or minor coronary artery disease. Regarding the objective examination of the patient, starting with general inspection, everything is normal in the patient besides general condition, which is unsatisfactory / severe because of the chest pain. The patient came feeling a lot of chest pain. She looks older than her natural age, especially because she lost a lot of weight, and she is a smoker and drinking, and she is in pain. Her posture is 4. She has orthopenic posture because she has problem breathing and pain in the chest. And when we look at the face, the patient has a pain face. Regarding her skin, is slightly pale, and she has subcutaneous fat very reduced / slightly reduced. Her eyes are sunken and depressed. However, the patient presents no jaundice, no deformities in sclera, or any other pathological symptoms in the eye area, and her body temperature is slightly elevated at the moment that general inspection was performed, and she presented a 37.3 temperature in Celsius. Regarding objective inspection of systems, we will start by respiratory system. The patient present regarding chest type, normosthenic, the right side of the chest when examining during inspiration and expiration. The right side of the chest falls behind and respiration act sinks down, especially when the patient is inspiring. The patient does present superficial respiration, wheezing. The patient does present also dry and raspy throat because of how much she coughs. The respiratory rate of the patient is 25 respirations per minute, which means that the patient is presenting rhinal tachypnea. And palpation, vocal fremitus is reduced on lower lobes of the lungs, and there is dullness in the same area when doing percussion. And auscultation, you have diminished vesicular breath, bronchosphonia, and the site of respiratory murmurs are not heard. The conclusion for respiratory system is that there is impairments are observed when doing inspection of respiratory system. When doing objective examination of cardiovascular system, we can see tachycardia, but however that can be due for a lot of reasons. So because the patient has elevated temperature, tachycardia can be due to that. The patient also has lack of sleep and general malaise, which would be a psychological / physical response. Tachycardia, so in that case, is also not pathological. And besides that, the patient also does not like the doctor, which means that the patient might have tachycardia because of anxiety. The patient, regarding other aspects of cardiovascular inspection, the patient presents symmetrical peripheral pulses, which is not an abnormality. Everything's good. There is normal blood pressure. There is no abnormalities in percussion of the cardiac shadow, no abnormalities in palpation, and no cardiac tamponade or things alike or pathological symptoms when doing palpation and percussion of the chest area for cardiovascular. The conclusion, therefore, is that there is no impairment in the cardiovascular system. When we're doing GIT, the only thing abnormal that can be observed when doing objective inspection of gastrointestinal system is the weight loss, but the conclusion that there are no major dysfunctions when doing palpation, percussion, and auscultation of intestines, stomachs, and things alike. When we look at the local status of the major problem is the thorax, and every problem was observed in respiratory system, so I will not be repeating them. So the conclusion and everything besides that is normal, so there is no pathological difference. There is no impairments, for example, in skeletal muscle tissue system. There is no impairments in neurological system. The patient is fully conscious. There is no impairments in liver, gallbladder. There is no impairments in other skeletal or no abnormalities regarding the patient's formation or body functions or arms, or no major lack of members, for example, lack of arms, lack of legs. Everything of the patient is normal. So the conclusion of objective and subjective examination together is that the patient again might have, none was discarded, tumor, right heart failure, which also can continue to be pulmonary embolism, chronic obstructive pulmonary disease, which is also called COPD, and minor coronary artery disease. However, further examination are needed. Regarding the tests made, two types of tests were conducted. You have laboratory tests and imaging tests, are also called instrumental tests. Regarding laboratory examination, it was ordered complete blood test, blood typing, cross-matching, platelet count, which are low, total count of red blood cells, which was also low, and white blood cells, which then presents alteration, which were leukocytes, which were low, and neutrophils, which were increased. Regarding blood chemistry of the patient, you have high calcium levels, low sodium levels, and increased uric acid levels. Other labs also may be abnormal, but they were not tested. Then we also did HCD, which is to check for pregnancy of the patient because she's a woman and fertile age. We also did COVID test, hepatitis test, HIV test, sputum analysis, and also tested the patient for diabetes, which she tested negative for all of those diseases. Regarding instrumental examinations, we ordered for the patient X-ray, computer tomography, MRI, ACG, and bronchoscopy. And the results of that is that a mass is observed in the lower lobe of the right lung. And then after that, biopsy was taken. The conclusion is that the patient presents a lung tumor mass in lower lobe of right lung, and the classification is 3T-M0, which is large in size, but no metastasis was identified. Regarding the plan of treatment, we chose and talked to the patient's family about a lobectomy of the lower lobe of the right lung with general anesthesia will be given, which is the main idea of the surgery is to remove the lowest lobe of the right lung, which is where the tumor was identified. And then the administration afterwards of chemotherapy to make sure that any cancerous cells were not there still in the body replicated if they were not removed during the surgical procedures, just as prophylaxis, for example. And after surgery, more tests will be run over to make sure that the patient is fine and the tumor was removed. Regarding epicrisis, there is no coexistent disease. The surgery is indicated. There is absolute indication for the surgery. There is no specific contradictions for this patient. However, it's elective surgery because the patient is not an emergency surgery. So more tests will be conducted and make sure that the patient is prepared and talk through before coming to the hospital to make the surgery because it will be a big procedure. Complications for the surgery is bleeding, lung collapse in case of any puncture, sepsis, and hemorrhage. And complication of diseases is metastasis of cancer in case that not all cancer is removed and chemotherapy is not administered correctly. Then you have preoperative care, which will be nothing per mouth, prophylaxis antibiotics, especially cephalosporin, anesthesia, which will include pre-anesthesia plus general anesthesia. Then we'll be doing shower that the patient possibly will do before coming to the hospital, and blood tests are done already, so the patient will not need any further one in the pre-surgical table. Regarding post-operative care, the patient will be giving analgesics. The patient will be giving ibuprofen, which is a non-steroidal anti-inflammatory drug, and which can be Advil. The patient will be taking Vitacone, which is a pain reliever opioid plus a non-opioid pain reliever. Then we'll have prophylaxis antibiotics, which again the patient will be giving cephalosporin, and 3 days of intense chemotherapy for the patient to be sure. And the patient will come back to the hospital in 3 months to recheck and do all exams again and to see if remission is present. If remission is not present, then the patient will keep doing specific treatment with oncological department, which she's already visiting. And that's all for the case report for tumors.